of who's out there and the multiple and varied connections that we have with what we call industry, but it's pretty broad. Okay, Public Health Network people, come on down. Are you happy to share a microphone?
Yeah.
Okay, we're heading towards the end. How are your brains doing? Yeah. We've got a couple more people after that, including the very exciting Anne Sheedy. Okay, now, just tell me when you want me to move that on and I will.
Yeah.
It should be going. Yep.
Testing, yep. Hi everybody, I know you've probably got a lot of info. This is just a really quick introduction to NTPHN and the primary healthcare networks. Just to give you a bit of an idea, I mean, not necessarily as relevant for you now, but hopefully, what we would hope in your future careers that you'll have some interaction with either NTPHN.
Can I just interrupt momentarily? The students, we encourage all the students, doesn't matter what specialisations they're in, to start connecting with the various organisations for a couple of reasons. One, to start getting some relevant experience, even if it's volunteer. And two, because in third year they have to do basically a year-long project which involves engaging in some way with some aspect of the industry, and I think the Public Health Network will be crucial. Doesn't matter what stream they're in.
Yeah.
So we need to start getting people in now.
But it's good to have who we are in the back of your minds, because we will be able to help at various stages throughout your career. And Danielle on the workforce team with myself specifically runs career pathway specific initiatives that might be of interest to you within the next couple of years. And later on, when we look at recruitment and retention and workforce for the NT, we've got specific supports in place for that as well. So primary healthcare networks are in each state and each territory. This is just a bit of an agenda really quickly, just to give you a very, very brief overview. But I'll just give you an overview of the company, the PHN, and specifically the recruitment and workforce team, which Danielle sits as a part of. So I'm the recruitment and retention team lead for the NT. And if you want to just move to the next one there. So we recruit both permanently and on a locum basis for health services, both in the Darwin area and in all of our remote communities. We recruit general practitioners, nurses, and allied health. So we look after the full spectrum of recruitment for health professionals. And we run a locum service. Now, locum service that we run specifically is for general practitioners at this stage. But there is another company called RAC, the Remote Area Health Corps, who manage locum placements for nursing and allied health. So we primarily focused on longer-term permanent recruitment, if you like, and we've got specialist recruiters in the nurse and allied health space. Grants then, in terms of supporting, I don't know if some of you are based here, obviously some of you based interstate. Anybody who is interested in taking up a placement for 12 months minimum in the NT in the future, we've got financial supports in place to be able to facilitate that and help you. If you're based in Darwin, likewise, and you want to go out to a more remote area, those financial supports are still relevant and still available to you. So we run a number of different grants to support relocation, cultural orientation for people coming up to the NT, to give them a bit of a taste and an overview of what the specifics are in that area. And then for all health professionals who are currently practicing in the Northern Territory, we administer education and CPD grants to enable them to either travel or, or attend events in other states, or likewise to attend any events here and cover the costs for some of those. The other area that is not so much workforce related, but it sits really closely with us in the PHN, is the outreach health services. So we employ health professionals and work with health services in the Darwin area to move to help health professionals get out to remote communities with a specific focus on, preventing, managing chronic diseases such as diabetes and some of those. So where there's not a health professional based locally, we'll facilitate that move for them to go out regularly to provide those services. So that's a really, really brief overview of what we do. I'm going to pass over to Danielle now, who runs the Career Pathways program as part of our team, which is specifically focused on students and people who will be the future workforce for the NT.
You should just keep talking, yeah.
You can hear me?
Yeah.
Absolutely.
Perfect. Thanks, Paul. Firstly, I just want to thank Robin for inviting us along this morning. I don't believe we've been along to one of these things before, so it's exciting to be here and to chat to everyone about the programs that we run and how we can support you potentially this year, maybe next year, or in the future when you're looking for roles. Yeah, my name's Danny, or Danielle, and I work for the Future Workforce, I coordinate the Future Workforce Initiatives for the PHN. So we have a range of programs that we're running this year and quite a few programs under development. So we'll go through a few of those. So the first one here is the NT High School to Health Careers program. Now that was formerly known as Rural High School Visits, and it's been run in the Territory for many, many years. So that's an exciting opportunity for existing students who are studying nursing, medicine, allied health, any health discipline really, or a certificate for in primary healthcare practice, to travel to Top End, Central Australia, and hopefully this year to Nhulunbuy, to promote health careers to high school students in some of the rural and remote schools. So you can see here we're running a program this year in April, so the 28th of April to the 5th of May in the Top End. So we look after Darwin and Katherine on that week program. Then we've got Central Australia, which is the 26th of May to the 2nd of June, and we look after Alice Springs, and we're going to go up to Tennant Creek this year. And then the East Arnhem program, we're still yet to confirm some dates with the high schools out there. But what the objective of our program is to promote health careers to students, to get them engaging in some workshops with the types of things that you would be doing in your health discipline. And yeah, just to kind of answer any questions, and we're really focused on breaking down the barriers to attending university. So, you know, answering any questions that they have there about potentially, say, moving, whether it be from Nhulunbuy or Alice, maybe Darwin, or if they're moving interstate. So we do get students from interstate that do come up on our program and do deliver that to the students as well. So we cover all of the travel and accommodation for the students. However, you do need to actually cover your own meals and amenities. However, we do support you in some cases with dinners and stuff like that. So when you apply for the program, you are strongly encouraged to seek approval from your university first, because our program does run throughout your semester. So you do need to get approval to come on board. And as part of the experience, we like to run some clinical speed dates, as we call them. So we'll try and hook you up with a local health professional, whether it be in Katherine or Alice, depending on which program you're on. And you can go and meet with them, talk with them about, you know, the career that you've chosen. They can answer any questions. You know, you might even be able to get into the clinic and kind of have a rundown on how their role works there. Yeah. So you don't have to have experience on one of our previous rural high school visits to come and participate in the program. However, you do need to be able to speak confidently about your course and studies and be able to promote your health career to large groups. So generally we talk to 70 students in a session at the high school. Sometimes they might be smaller if we're going out to some of the more remote schools. So you do need to be confident to talk to them in one-on-one situations. You need to have an understanding or willingness to learn the barriers to attending university or, you know, attending further studies. You also need to be able to conduct a workshop with 6 to 8 students and be able to engage those students one-on-one.
So maybe something for second year or third?
Yeah, so we do generally promote it mainly to second and third year, but we do want to promote it to the first year students as well for future years to come as we look to expand a few of our programs. What was on that page? Excellent. So we also run what we call the Health Workforce Scholarship Program. Now that's not directly relevant to you guys at the moment, but I just wanted to touch on it because it is something that we do run. So we provide scholarships and bursaries to health professionals who are already in the Northern Territory to attend courses and to engage in further postgraduate studies. So once you are working in the NT, you can contact us whether you want to go and do a postgraduate diploma or a master's degree. We can provide some assistance there. And some other programs that we're currently developing, so we've got the Student Mentor Program. So The role that we're looking at there is to identify high school students who are interested in a health career and link them with a university student. So if you're interested in, being a mentor for some of the high school students, contact us and we can, look at that. But we are developing that at the moment, so we hope to have some further information as the year progresses. So the Student Compass program, so each year NTPHN and NTGP run the Compass program in Darwin. And this year we're looking at providing some funding for health students to attend that conference. So that'll allow you the opportunity to network with the professionals that are already working in the health space, to discuss career opportunities, and also just to become up to date with the latest developments in health research in the NT. And then one of the final programs we're looking at developing is called Grow Rural. So that will be an immersion program that we're looking at targeting directly for allied health and nursing students to come and experience a weekend placement in a remote community. So part of it is clinical based. You'll get to meet the clinic and meet the workers there at the health service, but also kind of getting to know a little bit more about the community and what really happens in that community and nursifying yourself into that. So that is under development. And
so will allied health include health promotion?
Definitely. So all of the allied health. So we recruit to all different areas of allied health. So yeah, it's not limiting anyone. Pardon? Definitely. Yeah, absolutely. So any health discipline is what we're covering. So just to give you an idea on our programs for particularly the NT High School Health Careers program, we take medicine students, we take nursing students, we've taken speech pathologists, occupational therapists, mental health workers, health promotion, paramedics, all the medical imaging. Yeah, there's a whole range of health disciplines that we do there. So, and we're particularly after your feedback. So if you have any ideas on programs that we could run, or things that you've seen in other states that have worked really, really well, and you think that it could be something that could work well here, please contact us. So your feedback's really valuable, and we hope to create experiences for you guys that'll be really beneficial as you lead into your future career. So, yeah.
Thanks very much. That's fantastic.
Any questions?
And all well within time.
Paul does.
Yeah. I've got the contact details anyway.
Yeah, and just contact us. Give us a call. And yeah, we're here to help with anything, really. Cool.
Thank you.